I am Dr. Kumba Kumba Elias. I am a pediatrician and a senior lecturer in the university, Bara University of Science and Technology. The Department of Pediatrics, like other clinical departments, is really shared between Bara University and Bara Hospital. And so our main three objectives are really to offer patient care as a primary objective, especially on the side of the hospital. But on the side of the university, our main purpose is to train health workers as in the care of children, pediatrics and child health. And we train undergraduate medical students, postgraduate medical students who turn into pediatricians, but we also train other health workers who come in here for different reasons or from different backgrounds but want to learn something about children. So that's our main purpose, and with that we probably deal with about 500 children 500 students every year if you combine all this service. The other aim, of course, the other thing we do is research. There's a lot of research going on in here. Some of it has really changed the way children are treated either worldwide or in African in developing countries. One groundbreaking one I should mention is the switch from treating malaria with quinine tartesunate. Most of the evidence was gathered in many hospitals in Africa, including right here, and others as well that have come. Now, COVID, of course, affected the way we do things. Why? Because the wards, initially, the numbers of patients coming to hospital reduced, and we didn't have children coming in with COVID, and everyone thought children are free from COVID or won't get COVID. And then eventually, we started to see COVID in the second wave in June. In June, we admitted up to 14 children with COVID. We lost 3, but also had 2 of them had other problems as well. And the structure of the main COVID treatment unit of the hospital was not set up for children. It was because at the time it was set up, it was largely when we were still dealing with adults. But when children started getting sick and needing admission and care, we had to quickly work around and create space. There was a unit which we had earmarked for creating a newborn unit, and then we realized that we couldn't do that. So we delayed the newborn unit opening, and we decided to use that space as a COVID treatment unit for children. And that included, of course, renewed training for people, setting up equipment that is convenient, that can be used for children. And of course, when you admit a child, you admit a mother also, or at least a caretaker. So we had to work around how to prevent transmission between caretakers and children and health workers. So we implemented a very specific form of infection prevention and control. It was good that the team was quickly interested in helping and working with our patients. And so we were able to have medical officers, nurses, students. We didn't include students because we really don't want to, in such situations, we want to leave students out. Pediatricians, postgraduate students, all these came in and worked together, and we were able to save mothers. The other issues, of course, there are many challenges again with mothers, and the majority of the mothers and families we get here are poor people. So we had to find a way of raising funds to support their medicines, to support their food, because they need to eat and eat well, and to be able to maintain them until they were discharged. So we lost 3 children, as I said, to COVID, but we were able to save the others. Right now, as we speak, we have a new threat, especially among patients, among attendants, and the attendants are coming from all over the place. And recently, actually right now, there's a survey ongoing, and we've so far identified that about 5 attendants within the ward, before we could know it, have tested positive. And so we have picked them up, assessed them, and discharged some to home-based care. And we are following up on the others who needed a bit more care. So that of course, interrupted teaching and the way we do teaching, we have to observe. Now it's difficult because you have to balance the transfer of skills, the care of patients on a daily basis, and the students around you to be able to teach them effectively and still reduce transmission. So that means that we have to keep our masks on at all times. Recently, we've just been repairing all our hand washing points in the sinks. We avail hand washing points outside the ward and inside the ward at every corner, so that there is not much room for transmission. We have had some health workers as well fall sick along the way. I think cumulatively we had about 15 or 16 health workers in this department getting sick. Luckily enough, all of them were treated and came out well, and they are back to work. And but they are more careful than before. So then of course other activities like research also slowed down because the numbers of patients that we had already planned to recruit into different studies started reducing in the COVID lockdowns. But as soon as they eased lockdowns, people came, and most studies have gone on thereafter. So no major current interruptions right now. The issue of, I think the thing about this hospital and its relationship with the university is that people, the public, trusts that when they come here they get a service. So even when lockdowns were, the lockdown was quite stringent and people couldn't travel, our numbers reduced, but we still were able to continue providing a service, and patients continued coming, those who really needed to be here. And as soon as there was some easing, the place filled up again. You'll see in the ward that we have, basically we are overflowing with patients because people trust that they come here and they will get a service, and we have tried to maintain that standard and that quality during the COVID lockdowns, but also thereafter. And we hope that as more people get vaccinated, everyone will be more comfortable and freer to come and seek health care and get a service here.